Hello and welcome to episode 62 of the Low Back Pain Podcast. I'm your host, Dr. Grant Elliott with RehabFix online low back program. And today's topic is how you should structure your low back warm-up or your low back rehab to best optimize results. If you missed episode 61, it was all about how sometimes multiple opinions or second opinions can actually be quite harmful depending on the advice that you're getting. And we used a real life situation with one of my clients who was seeing extremely good results within the first few weeks of the program. And then he was provided some inadequate advice, and it ruined a lot of the progress he had made in a real life scenario of exactly how that happened. So go listen to episode 61 if that interests you. Also, if you have not joined my private Facebook group yet, you need to go join my private Facebook group. Just this week, I posted my full lower body warm-up to that page. 8-minute long warm-up, the exact warm-up that I go through step by step, detailed in the description. And you can ask any questions you want about that warm-up in the comment section, and I will answer you directly. And I am posting additional exclusive content to that page. You need to go join our private Facebook group called RehabFix Low Back Program. So let's get into today's topic. How should you structure a warm-up? Or how should you structure your low back rehab? So first off, for those in the movement world, you've probably heard the phrase mobilize, then stabilize. This was kind of built off of the whole FMS world, the functional movement system world, mobilize, then stabilize. The theory is that you want to increase the range of a joint or tissue and then load the joint or tissue through that same range to stabilize or help the nervous system adapt to that new range. And that's true. However, I'm going to switch it up on you and give you some reasons why. If you go to my private Facebook group and you watch my warm-up, you will see that the very first exercise I start with is the dead bug. And the reason why I start with a dead bug and I don't start with a mobility movement is because of this. If you take someone who has poor breathing patterns, poor core fundamentals, they're not properly stacking their rib cage and pelvis, and their breathing system is just all whacked up, and their body doesn't know how to stabilize intrinsically, doesn't know how to stabilize properly, they will have tight hips, they will have tight hamstrings, they will have tight lats, they will have tight glutes. All of these things will be tight. And so this is someone that might consistently get adjusted or consistently get soft tissue work because they're always tight, but really it's because of their core function. So let's take someone, and this happens all the time. I've actually posted this as a hamstring test before. Let's take someone who tries to bend over to touch their toes or sit and bend forward to touch their toes. And they might say, oh my gosh, my hamstrings are so tight. I've never been able to do that. You take that person through 5 minutes of proper belly breathing patterns, proper diaphragmatic breathing, and you do a couple dead bugs with them, all of a sudden they can touch their toes or they can sit forward and touch their feet with their seated hamstring stretch. But you did not stretch their hamstrings. You did not stretch their low back. You did not mobilize their joints. But all of a sudden they can go further. That is a sign of core dysfunction, okay? That's a sign of poor breathing patterns or other core-related patterns. So if priming your core properly and priming your breathing properly can increase range, then why would I shortcut that with doing mobility work first? Because if I do mobility work first, I might only be able to get so far before I then do a core stimulus and then go further, right? So here's what I mean. The old saying, mobilize and stabilize. Okay, I will try to mobilize, let's say, my shoulder. Or we'll just talk about the low back. That's what this podcast is all about. We'll try to mobilize my low back as much as I can. And so you'll be able to push further into a movement, but it's only going to let you go so far. And then if you immediately load that movement, then you're loading the range you just achieved. But you'll be able to achieve more mobility if you prime your core first. If you work on some belly breathing and you do some dead bugs, some bracing stuff, then you do your mobility, you will be able to do your mobility movements further and better, because it will unlock your body's ability to go into that, because it's telling your brain, or your brain's telling your body, hey, we're good. We got the breathing patterns down. We got the stability down. We're good. Joints, you can go further. We can support you now. So now your joints are going to be able to go further. And then once your joints are able to go further, you have greater mobility. And then you load that mobility. Then you load it. So it's kind of like a sandwich. I do not advise mobilize and stabilize. I do stabilize, mobilize, stabilize. You will notice an immediate difference with this. So before you do your low back rehab or your shoulder rehab or any type of rehab or warm-up scheme, once again, go watch my warm-up. I literally give you the gold, okay? I always start with a stability movement to allow the rest of my body to release. So by doing the dead bug, I'm allowing my hips to release, my shoulders to release, my spine to release more. And release is a vague term. I know a lot of people don't like that term. Neither do I, but it's just a vague term that just means helps them open up, okay? It's helping everything open up. And then after that, I get into my hip mobility, my thoracic mobility, my lumbar mobility. And then I load those after. Okay? That's the sequence that I go through to optimize my body's function as much as possible before I go train. So if you're finding that whenever you're doing different stretches or mobility movements, that every time you do them, you can only go so far. Man, I'm always tight with this movement, but I get tight with it like every hour, or maybe every morning you're just as tight with it. Okay? It's because, well, one, it might not be the right movement. Okay? It might just be completely the wrong movement. But two, your sequencing might be wrong. So you might be pushing to this stretch a little bit more. Sure. But if you're not reaching the potential that your body could go, if you checked these other boxes, then your nervous system will not be able to adapt to that new range. So let's make this really applicable, okay? Let's say you have a shoulder issue, you're always stretching your shoulder, do some dead bugs and some scap stability work before doing your shoulder mobility. And then after doing your shoulder mobility, then do your shoulder workout or your rotator cuff exercises. That's what I would do. Now let's say your low back, okay? Let's say you're trying to do some lumbar rotation movements, okay? Let's just say that. You're going to do some open book or some bretzel, things like that, okay? You're trying to improve your rotation. Maybe you want to improve it for golf, okay? What I would do is I would do like a few minutes of belly breathing. I would do a couple sets of dead bugs. Then I would do some open book, some bretzel, some windshield wipers, some kickovers, some scorpions. And then after that, I would get into maybe some loaded rotation, some wood chops, some landmine rotations. And there's many other ways to load rotation. Palloff rotations, Palloff press variations. Then I would load it. That's what I would do. So we're going to unlock your body's ability to go further. Then we're going to go into those movements further. And then we're going to load them at a further range than you would have been able to go if you had not provided your body that initial core stimulus. That's the sequence that I find provides much better results. And this is proven all the time. A lot of our clients, about 95% of them, will find that the longer they sit, the worse their low back feels. Bending over to put on their socks and shoes first thing in the morning, they feel extra tight with one particular hip, or they feel extra tight with the lower back. Usually, if they've been sitting for a long time and they go to stand, it'll be really tight to stand up straight. This is 95% of our clients that we just absolutely hit a home run with, okay? And what we find is that even though 95% of our clients have those same symptoms, not all of them can immediately get into mobility movements. Probably once every few weeks, we'll get a client where we say, hey, you know what? Before we can even do the mobility movements that are obviously going to address your restrictions, we have to do breathing or dead bugs or hip stability movements right before doing our spine mobility. Otherwise, the spine mobility is painful. This happened just the other day. I tried to take a female from, forget exactly where she was from. It's not significant to this example, but I was trying to take her through some low back mobility work, and it was painful. She was saying, ow, ow, ow. Every time I do this, it's hurting worse. I said, okay, let's take a break. Based on your assessment, We can see you have a significant extension restriction. It's obvious. We both knew it. The second she tried to stand and lean backwards, the second she did it, ow, oh my gosh, deep stabbing pain. Okay. So we couldn't have her get on her stomach and just start doing cobras. It wouldn't work. Every time we did it, it made it worse every time. So instead I said, hey, you need this movement, but your body's not accepting it. How are we going to change your body? How are we going to change your nervous system? How are we going to change the tone of your low back and your joints to get it to accept it? So we went through some core foundation stuff. We went through some core fundamentals, some core function work. That's what we focused on for a brief minute. And then we went back to our extension work. And then all of a sudden she could do it. All of a sudden it was pain-free. She could do it. We could do multiple sets with that. And then it improved her overall function. It was amazing. It really, really was amazing. So I hope that this gives you a better idea of maybe how to restructure a couple things in your programming, and maybe gave a couple clues as well. And once again, if you are not in our private Facebook group, RehabFix Low Back Program, you need to join our Facebook group because there's access to myself and my team like you will not experience anywhere else. And you can get direct answers from me with what you are currently struggling with. And if you are having a hard time dealing with your current low back issues, like those 3 things I mentioned earlier, longer you sit, worse it feels, bending over to put suction shoes on in the morning, hard to stand up straight after you've been sitting for a long time, and you've been struggling to find relief, you've been going months, years, seen a PT, seen a chiro, not really gotten anywhere, been told some bad advice that you know isn't helpful, being told to stop exercising, and you're realizing, hey, I think it might be about time I do something about this, because obviously you're looking up some low back advice. You're looking up some low back podcasts. That's why you're listening to this. And if you feel like you're spinning your tires, let's cut to the results. Fast forward to the results, okay? Let us help you. Give us the opportunity. Jump on a call with us. Let's show you what we can do. Let's show you what that plan looks like for you, so that you can maybe get some results live with us before we even start the program. So we can show you exactly what your issue is, exactly what you need to do to resolve it. You can have the plan laid out right in front of you on a silver platter. Because this is the way we work. We show people the plan. We show them exactly how this works before we do anything. We provide results before you do anything. There's no one else out there that does that. So give us the opportunity to help. Submit an application, contact us so we can meet and go through this together as a team. If you're watching on YouTube, please like, comment, and subscribe. If you're listening on your favorite podcast platform, please leave a 5-star rating and review. As always, move more, move in nature, move in the sun. Thank you so much for listening, and have a great day.